Thalassemias. Definition. The thalassemias are the most common human monogenic disease. These are the rare disorder of hemoglobin synthesis are characterized by a reduced production of globin chains of hemoglobin. Application in nursing. The nurse performed education on thalassemias may be implemented by using information channel, use of media, posters, and informational booklets, which are left at various cases such of family planning clinics. The sentenced messengers should include the clinical manifestation, natural history, available therapies.
Thalassemia major is an inherited blood disorder in which the infected children are unable to maintain hemoglobin in the normal range. Their bone marrow cannot form sufficient red cells, and red cell survival is also reduced. This makes them extremely anemic. They also require regular blood transfusions and medicines, which are very expensive. Let's try and understand this disorder better. It is estimated that about 3.4% of the Indian population is a carrier of thalassemia or suffering from minor thalassemia. Every year, 7,000 to 10,000 children with thalassemia major are born in India. It is more prevalent in communities like Sindhis, Punjabis, Gujaratis, Marwaris, Bengalis, Saraswats, Gaurs, etc. How is thalassemia caused? Thalassemia is of two types, minor and major. Thalassemia minors are people who carry one defective thalassemia gene. They are normal except that during stressful situations in life, like surgeries or during pregnancy, they may have complications due to low hemoglobin. Thalassemia major is a serious blood disorder which causes severe anemia and related complications. This is caused by the presence of two defective genes acquired from each thalassemia minor parent. When both parents are thalassemia minors or carriers, there is a 25% chance of birth of a thalassemia major child, 25% of a normal child, and 50% chance of a thalassemia minor child. Living with thalassemia major is a challenge to say the least. Patients need regular blood transfusions every 3 to 8 weeks to maintain normal hemoglobin levels. With regular transfusion and removal of iron through chelation therapy, however, thalassemics can live and grow into adulthood. There is no real cure for thalassemia except bone marrow transplant. Thalassemia can lead to several complications too. Due to regular blood transfusions, there is a high chance of thalassemics being exposed to blood infections like HIV, HBV or hepatitis B, and malaria. If the donor's infection is at an early stage, the infection may not even be picked up during donor blood testing before transfusion. Thalassemia patients can also develop iron overload due to repeated blood transfusions. Unfortunately, the human body has no natural mechanism of excreting the excess iron from the body and needs to be removed by using iron chelated drug.
Pros and cons. The pros. There are many people with thalassemias are adapted to their anemia and require no training itself. The training of people with the thalassemia majors is by seed of regular administration of blood transfusion. The cons. The thalassemias patient did close of the first decades of life, mainly due to the heart failures by iron overdose.
Hello, I'm Harry, and I'm your friend. A tiny friend that lives inside you. Where? In your blood. The red stuff that sometimes comes out when you hurt yourself, and
I'm not alone. I have a huge family of many cells, all of which are red and look like small plates. We all have an important job, and this is to carry oxygen, a substance that you take from the air when you breathe, and one that gives you lots and lots of energy. Many blocks of the special stuff called hemoglobin inside us help us to carry this oxygen. I should also mention that we red cells are not alone in blood. 3 other families of friends are floating around. The white cells family, the platelets family, and the plasma family. We all have different jobs to do, and of course we look different, but we all work together to keep your body healthy and strong. The white cells are wibbly-wobbly and white, and act like little soldiers, fighting off germs to keep you healthy. The platelets look like tiny eggs, and gather and stick together like building blocks to help you stop bleeding. On the other hand, the plasma is a yellow, watery stuff in which all of us float, and carries many nutrients that your body uses to keep you healthy and strong. Do you know where blood and all of us in it come from? Right, from a factory inside your bones. Sometimes, however, there is a problem at this factory, and things go wrong. For example, sometimes it can't make red cells with the right helper, the hemoglobin inside. When this happens, then the red cells can't carry enough oxygen, and without this special nutrient, your body feels tired and you look weak and pale. Doctors call this anemia or thalassemia. Lots of children around the world have thalassemia, so if you have thalassemia, your red cells are weak and need a bit of help from the doctor. The best way the doctor can help you is to give you some new, strong red cells. This is called transfusion. What happens is that your doctor or nurse puts a tiny needle in your arm, which is joined to a plastic bag of lovely, new, strong red cells. This won't hurt much. But unfortunately, these new red cells don't stay long in your blood. After a short while, they break up, and your body feels tired again. The doctor knows that, so after a few weeks, you will be asked to come back to the hospital to have some more new red cells. All of these new red cells are a great help, but your body still...
Use a plague in Ecuador. In Ecuador there are 5 cases with thalassemia, therefore its treatment is based on blood transfusion.
Blood is an incredibly important life-maintaining fluid that circulates through the body's heart, arteries, veins, and capillaries. Blood carries nourishment, electrolytes, hormones, vitamins, antibodies, heat, and oxygen to the body tissues. Because of the intricate complexities involved in the production of blood and the function of blood to support the entire body, some disorders may occur in the blood or its components. One such significant blood disorder is thalassemia. Thalassemia is a blood disorder passed down through families in which the body makes an abnormal form of hemoglobin, the protein in the red blood cells that carries oxygen. The disorder results in excessive destruction of red blood cells, which leads to anemia. There are an estimated 60 to 80 million people in the world carrying the beta thalassemia disease alone. This is a very rough estimate. The actual number of thalassemia major patients is unknown due to the prevalence of thalassemia in less developed countries. Countries such as India and Pakistan are seeing a large increase of thalassemia patients due to lack of genetic counseling and screening. There is growing concern that thalassemia may become a very serious problem in the decades to come, one that will burden the world's blood bank supplies and the health system in general. About 9,000 thalassemia patients are born every year in India. These children suffer from many health consequences like chronic anemia, gross facial deformity, etc. Causes of thalassemia. Hemoglobin is made of two proteins, alpha globin and beta globin. Thalassemia occurs when there is a defect in a gene that helps control production of one of these proteins.
Thalassemia is a complex group of inherited disorders. There are two major kinds of thalassemias. There's alpha thalassemia and beta thalassemia. Beta thalassemia is of three types. We have the major, the minor, and the intermediate. But the children who require most of the transfusions or hypertransfusions are the children who suffer from thalassemia major.
Thalassemia major occurs when the child inherits the defective gene from both parents. Thalassemia Beta thalassemia is one of the most common genetic disorders in the world. Approximately 40,000 children are born each year with a serious form of the disorder called beta thalassemia major. It can cause severe anemia, a condition where the blood does not have enough healthy red blood cells. Beta thalassemia is caused by a malfunction in the gene that makes beta globin, a protein that is used by normal red blood cells to carry oxygen throughout the body. People living with beta thalassemia cannot make enough or any beta globin. The current treatment is frequent and lifelong blood transfusions that deliver red blood cells from donors to the patient to correct the anemia. However, the transfusions also cause iron to build up in the body, which may cause severe damage to organs, abdominal pain, weakness, fatigue, and joint pain. So patients who receive blood transfusions also must take additional medicines to remove the excess iron. This treatment is called iron chelation therapy. Bluebird bioscientists are researching an investigational gene therapy approach as a potential treatment for beta thalassemia major. In the laboratory, a corrected or functioning copy of the beta globin gene is packaged into a lentiviral vector. The vector contains a small number of parts from the human immunodeficiency virus, or HIV. The HIV parts are used because they are effective at entering cells and delivering the functioning copy of the gene. The vector has been changed so it cannot grow or cause HIV infection. Next, blood stem cells are collected from the patient.
Conclusion. The alpha thalassemias represent a global health problem which a growing burden. A refined ethnology of the molecular basis of thalassemia will be fully relevant from a public health perspective only it is complemented by the likely epidemiologic data.